Hi, everybody. My name is Callie Khan, and I was able to schedule my informational interview with Josie Graham. Her official title is Public Health Program Manager number 2. She's currently working at the Idaho Central District Health Department. She works in District 4, so she gets to oversee Elmore, Boise, Ada, and Valley County. Um, so her current role in her job description is so she oversees, supports, and supervises family programs such as oral health programs, home visiting programs, parents as teachers, and infant and childhood early mental health programs. She also oversees any environmental health programs that are happening in other counties. So in her role specifically, she supports other managers who are below her who oversee these departments as well. So she doesn't do home visiting. She doesn't do any data entry. She doesn't do any reports. She kind of oversees everything, but she's not on the ground level anymore. I was super intentional in my interview to base it around as of an organic as of a conversation as I could. So we didn't have super hard and fast interview questions. Just asked her how she got her position, her view on public health, any advice she had, things of that nature. Probably one of the most interesting things I learned from Josie that I didn't know is that Idaho actually has a decentralized public health system. So instead of one public health system that oversees the entire state and all the various departments within that, the Central District Health is made up of 7 local public health districts in Idaho. And so each of those districts oversee individual portions of health. So some will be like maternal and children, some will be environmental, some will be like licensing and food inspection, which I thought was really interesting. While she has her master's degree, I asked if she thought that it was important that all who get their bachelor's in public health go on to get their master's in public administration or public health. And she said that she didn't think that was super important. Her her biggest piece of advice and the way that she views public health specifically is really this emphasis in creating better bureaucrats and creating better bureaucracy, and creating a workforce of people who want to go out and really advocate for the most vulnerable and work in their communities to better serve them and improve them. She recommended, of course, that you get involved with internships as soon as possible, and that when you go in for an interview, she said as a manager that what she thinks will really put the edge on people who are applying for the same interview, of course, once you look past your academic achievement, is positivity, optimism, and really just a dedication to being committed to this field and wanting to improve the lives of so many. She said that, she loves public health, and she thinks that one of the best things that you can do in terms of our public health system is invest in programs that emphasize on prevention of diseases and negative health outcomes rather than just treat them, treat any ailments that come up as they go. She is passionate and she is dedicated, and she has really extensive work history. She got started at Planned Parenthood and then worked at Department of Health and Welfare, and now she's at Central District Health Department. So while I'd like to really be involved in some of the projects she's done previously, right now with where I'm at in my life, what I want to do, I don't want to, obviously, get a manager position quite yet, because I want to do the home visits and the data entry and reports. However, I'm definitely still interested in pursuing the career path that she did, just based on all the experience she's been able to get and all of the projects she's been able to manage and work with, and really this change that she's been able to create, that she's been able to see. The most helpful thing about my informational interview with Josie is that she said that I am welcome to reach out to her in the future, and she has tons and tons and tons of contacts, especially with people over at Health and Welfare. She has contacts at Planned Parenthood. She has contacts at Central District Health Department. So I think my key takeaway from this assignment is just to connect and put yourself out there and really see who you end up having in your corner.